11% of South Africans are not documented. If you look at our population, 11% will be about 6 million people. They don't have any form of document, but they are not illegal. In Operation Dudula has got no way of knowing who is a foreign national or who is an illegal immigrant. Only Home Affairs can know that. They can't expect us to chase people away when they are sick, whatever the circumstances of their nationality. Problems are solved through the laws because we can't be a law of the jungle in our country.
Hello everyone, welcome back to the channel. In this video, we're looking at the Health Minister Dr Aaron Motsoaledi's recent remarks on Operation Dudula and the ongoing battle over undocumented foreigners accessing our public healthcare system. After a lengthy meeting with Dudula, the minister made his position crystal clear. And from where I'm standing, it's obvious that he's not on the side of South Africans. So we'll be breaking down exactly what he said, why it's problematic, and what this says about the ANC's priorities. Let's get into it.
To discuss this matter further, we're joined by Health Minister Dr Aaron Motsoaledi. A very good evening to you, Dr Motsoaledi. Thank you so much for your time. I know that you've condemned protests by Operation Dudula and other civic groups targeting healthcare facilities. But on the other hand, the movements have vowed to continue questioning patients about their nationality and demanding identity documents. What is your stance on the position? What is your position on that stance? Because they're saying that they're going to continue.
Well, Paul, I met Operation Dudula yesterday. We met for about 3 hours. I took them through this whole process of immigration. And I told them they might be solving what looks like a legitimate problem, but using wrong means. Because in health, we treat everybody who enters there who is sick. And they can't expect us to chase people away when they are sick. Whatever the circumstances of their nationality is just not allowed in healthcare anyway. And they must not confuse issues. There is this belief, Mpo, that healthcare is free in South Africa, but not in any other country in the world. And I want to correct that. Healthcare is free for children under 6 and young women. That was declared by our founding president, Nelson Mandela, in 1995, I think. Yes, so we only offer free healthcare for pregnant women and children under 6 of whatever nationality. The other people are not offered free healthcare. They are charged, but the problem is, if you come to hospital without money and there's an emergency, there is no way you won't be treated, because then the Department of Health will be sued. It will be litigated in a way unimaginable. They then proposed to me that because doctors and nurses have signed an oath, have taken an oath of office, and they are forced by the oath to treat everybody. The clerks in the hospital did not take an oath of office. We must instruct them not to give anybody a fine if such a person does not have documentation. This was my response to them. First, yes, I responded to them in 2 ways. Number one, and I want the country to know that on the issue of civil registration and vital statistics, it is a problem in the whole African continent. Many African countries have not been able to register all their people. In fact, according to the statistics we have, the country that is far ahead of registering its citizens is Egypt. It has registered its citizens 98%, which means 92% of Egyptians don't have any documentation whatsoever. In South Africa, we are at 89% documentation, which means 11% of South Africans are not documented. If you look at our population, 11% will be about 6 million people. They don't have any form of document, but they are not illegal because they are in their country. They are South Africans, but they've got no document, nothing whatsoever. They don't appear in any database. And I think the prime example you may remember is our Bester. And we found that most of his relatives were not registered. So I said, if you do it the way you are doing it, you are going to turn away many South Africans who are legitimately South Africans, but do not have any documents. Having worked in Home Affairs, I met such people. I met people who are 64, 65, who are South Africans, but they've never had any document.
Yeah.
So I said they must be very careful exactly what they are doing. Secondly, I said, if we instruct the clerks not to give anybody a fine, and they go out and die, you are going to be sued. Imagine a pregnant woman who gets into a hospital, refuse to be seen, go out and deliver a baby in the street. And I'm sure you know that that has happened many times and we are attacked. So I warned them about those things. And they said, now, do we just fold our arms and do nothing? I said, no. As a country, we are not saying we must do nothing. You remember, Mpo, when I was in Home Affairs, firstly, I launched the Border Management Authority to try and make the border safer. Secondly, I reviewed all the immigration laws and drew a new white paper on immigration, if you remember. A white paper in which I proposed that we need to repeal the Citizenship Act, the Identification Act, the Refugee Act, and the Immigration Act, and start them from the beginning, because there are quite a number of mistakes there. So I said the route they are following is a law of the jungle.
Minister, if you'll allow me, just for the sake of time, I mean, on one end, we're dealing with a human rights violation issue, and then on the other hand, is an indication of a much, much deeper issue, perhaps misguided frustrations of South Africans living in a country where they feel that their own dignity and humanity is undermined as you talk to some of these pressing concerns, because it seems to be a collective anger that needs to be directed and leveraged. How are you going to do this? Because it seems that even after your meeting, these questions will continue, because this is something that cannot be discussed and with no proper conclusion, with no proper direction on where to from now.
Well, there is a proper conclusion. It's just that they didn't take it. I told them there's no way us in health can identify people as illegal simply because they've got no documentation. And I gave you the stats. I hope you understand that. That us in health have got no way, there's no way, even Operation Dudula has got no way of knowing who is a foreign national or who is an illegal immigrant. Only Home Affairs can know that, not us. So they shouldn't expect us in health to become Home Affairs officials. We don't even have that capacity and the skill. So I said, in solving their problem, they shouldn't really come to health. But secondly, I told them that I advised them that problems are solved through the laws, because we can't be a law of the jungle in our country. And that's why I give them example of the laws. And I even complained, when I was in Home Affairs, Operation Dudula used to march there many times.
Yeah.
They never went to health. When I'm in health, they are now coming to health. As if all these issues of immigration has to be solved by me. So I told them that we have got no option, because we don't have a capacity nor knowledge. We'll always call police when something like this happens. And anybody who enters the hospital yard, we'll have to treat that person.
Yeah.
We can't, as health, send them away as they were demanding. But
Minister,
when they stop them in the streets, it's also not us in health, because we don't have that capacity. It's an issue of law enforcement, not ours.
So last night on SABC, Minister Motsoaledi condemned Operation Dudula and other civic movements for blocking health facilities and questioning patients about their nationality. He confirmed that Dudula members met with him for 3 hours, and while he acknowledged that they were trying to address a real problem, he dismissed their methods as the law of the jungle. Let's be honest here. What he's really saying is that South Africans have no right to protect their own health facilities from being overrun. He made it very clear anyone who enters a public hospital yard will be treated regardless of documentation status. Now, the minister tried to sound reasonable. He told us healthcare is only free for pregnant women and children under 6, regardless of nationality. He said everyone else must pay, but here's the reality. In practice, almost nobody pays for public healthcare. Go to a clinic or hospital, tell them you don't have money and you'll still be treated, South African or not. That's the truth, and illegal foreigners know this. Then he brought up what to me is one of the most shocking points of this entire interview, that South Africa has 6 million undocumented citizens. 6 million. And instead of this being a wake-up call on how dysfunctional our home affairs system is, he uses it as a reason why Dudula's actions are wrong. He says we can't tell who's foreign and who's not because even millions of South Africans don't have papers. But why is that, Minister? It's corruption, lack of infrastructure, and ANC mismanagement. That's why so many citizens are undocumented. But instead of fixing that, the ANC decides to use it as an excuse to keep the borders open and let anyone use our services. Minister Motsoaledi then went on to claim that if hospital clerks refused files to undocumented people, someone might die outside and the department would get sued. Fair enough, but that's the risk that patriots on the ground are already willing to take. People in movements like Dudula put themselves on the line for this country. They face arrest, they risk their lives, and what do our leaders risk? Nothing. Then, of course, he gave us the standard ANC lecture. You must follow the law, don't take it into your own hands. He reminded us that when he was in Home Affairs, he pushed for the repeal and rewriting of key immigration, refugee and citizenship laws. And yes, that would have been the right move. But here's the problem, it never happened. All that talk went nowhere, and now he's in a different ministry, leaving all those promises behind. So when he tells us to trust the process and follow the law, it's pure gaslighting. He knows the process doesn't work. He knows the ANC has no intention to bring reform. He knows South Africans are left exposed. At the end of the day, the minister's stance is simple. Undocumented foreigners will continue to get treatment in our public health system, and if you try to stop it, you will be arrested. That's the line in the sand, and it's yet another reminder that this government will always put the interests of outsiders ahead of its own people. South Africans are tired, we are angry, and no amount of polite meetings or promises of reform will change the reality on the ground. Let me know in the comment section what you thought about this interview. Watch the video on your left to see a South African woman explain how she was denied free healthcare in Nigeria. Don't forget to hit the like button, subscribe to the channel, and hit the notification bell. Until next time.